Types of anemia. What is anemia? Anemia is a condition where the blood has a lower than normal level of red blood cells or hemoglobin, leading to a reduced capacity to carry oxygen to the body's tissues. This can result in various symptoms like fatigue, weakness, and shortness of breath. Anemia is not a disease itself, but rather a sign of an underlying medical condition. What is MCV of red blood cells? The mean corpuscular volume, or mean cell volume, is a measure of the average volume of a red blood corpuscle. MCV quantifies the average volume or size of red blood cells, also known as erythrocytes. The normal MCV range is typically between 80 and 100 femtoliters. What are the types of anemia? Anemia, according to the mean corpuscular volume, MCV, is classified into three main types. Microcytic anemia, anemia with low MCV. Normocytic anemia, anemia with normal MCV. Macrocytic anemia, anemia with high MCV. Let's discuss it in details. Microcytic anemia. An MCV below 80 femtoliters suggests microcytic anemia. MCV is below the normal range, indicating smaller than normal red blood cells. Common causes include iron deficiency anemia, thalassemia, sideroblastic anemia, and anemia of chronic disease. Normocytic anemia. An MCV within the normal range, between 80 to 100 femtoliters, indicates normocytic anemia. MCV is within the normal range, meaning red blood cells are of normal size. Common causes include acute blood loss, chronic diseases like kidney disease, liver disease, or infections, hemolytic anemia, and aplastic anemia. Macrocytic anemia. An MCV above 100 femtoliters suggests macrocytic anemia. MCV is above the normal range, indicating larger than normal red blood cells. Common causes include vitamin B12 deficiency and folate deficiency.